Thank you. Next, join us for a thought-provoking talk by Patrick Kennedy, former U.S. representative and co-founder of the Kennedy Forum. Today, he is going to share his insight and experience in mental health and substance abuse issues. In the wake of COVID-19, the United States has been seeing unprecedented rise in the addiction issue and mental health problem. But now, it is not a unique problem to the U.S. So please join me in welcome Patrick Kennedy.
Good afternoon, everyone. How's everyone doing? Isn't this a fantastic conference? I mean, just fantastic. I really want to thank the Stavros Niarchos Foundation for using their ability to put all of us together and finally focus on an issue that has never received the kind of attention that we are all paying to it right now at this conference. I am someone, my name is Patrick Kennedy, I am a person in long-term recovery, which means for me that I have not had to drink or drug or use any mood or mind-altering substance since February 22nd, 2011. That was You can applaud me because it's so difficult. If you have the disease of addiction, trying to stay sober is a difficult thing to do. And what I'm here to talk about is what are the public policies that we can put in place, not only here in Greece, around Europe, and around the world, that will help make sure that our healthcare system treats mental health the same as the rest of physical health. When I was in the United States Congress, I had the honor of being the primary sponsor of a piece of legislation called the Mental Health Parity and Addiction Equity Act. That's a mouthful, I know. This law said something very simple. It said that the brain was part of the body. And you know how long it took Congress to pass this bill? Over a dozen years. I became the sponsor of this bill as the youngest member of Congress at the age of 27. That tells you how much stigma was back then, because none of my colleagues in the United States Congress wanted to put their name in front of a piece of legislation called Mental Health Parity and Addiction Equity Act. In other words, the words mental and addiction made it such that none of my colleagues wanted to put their names as the sponsors of the bill. I am someone who already was well known to have addiction because I grew up a member of the Kennedy family. My uncle was President John F. Kennedy. My father is the late Senator Edward Kennedy. And so when I first went to get psychiatric care and addiction treatment, it didn't last as a secret for very long. I don't know if you have tabloids here in Greece, but we have something called the National Enquirer in the United States. And I was in my second term as a state legislator, and I ended up finding myself on the cover of the National Enquirer. When you're on the cover of National Enquirer, it's not a good thing, I can tell you. So what had happened was the guy that I was in drug treatment with sold his story to the National Enquirer for $10,000 to say that he was in drug treatment with a Kennedy. At the time, I thought it was the end of my political career. But I soon found out that my constituency was more upset at the guy that had ratted on me than they were at me for being a drug addict. So I got reelected. And I got reelected and reelected, and I went to Washington, D.C., and I didn't have to worry about keeping this a secret any longer. If that man had not outed me, I would have continued to try to keep this a secret, right? Because if you have a mental illness or addiction, you don't want anyone else to know because you feel the shame of having a brain illness. Furthermore, most of the time, you are the last person to know that you have a mental illness or addiction, because the single characteristic of the disease of mental illness and addiction is that you, as the person suffering from it, are the last person to see it in yourself. So we have a lot to do in this world that we're living in today to finally treat mental illness and addiction as the brain illness, the physical illness that it is. What I have tried to do in my advocacy is map, just like the neuroscientists that you've heard talk about mapping the brain. I want us to map the public policy that's needed to help people and our society address the public health crisis of mental illness and addiction. The disease of addiction is what they call a biopsychosocial illness. If you're in recovery, you say it's a physical allergy, a mental obsession, and a spiritual malady. But the point I'm making is it's three-pronged. It takes the medicine, it takes the counseling, and it takes social connectedness and a belief in a higher power. Those are the three elements. And if we as a people want to make sure that these illnesses are treated effectively, we need to make sure that all of those areas are mapped out. So in the physical element, we want to make sure that mental health is screened when you go to the doctor for your first checkup. I am an asthmatic, so I inhale this thing and I need more meds. So when I go to the asthma doctor, I need the asthma doctor to ask about my depression. When I fall and I cut myself, which I've done, when I go to get the surgeon to suture me up with stitches, that surgeon better know that I'm in recovery from an opioid addiction, because that surgeon could prescribe me opioids, not knowing that prescribing me opioids could be the thing that kills me. So it's important in the medical system that mental health and addiction be integrated into the rest of physical health care, especially through these electronic health records, and especially in terms of making sure it's part of your health chart. And so then the next piece is the mental health piece. We need to have more therapists of all kinds. We need more psychiatrists. We need more psychologists. We need more peer supports. We need more social workers. We need more community healthcare workers. What are you in Greece, what are we around the world going to do to make sure there are enough people in this treatment field to treat all of the people that are suffering from these illnesses? We don't have enough people. The reason we don't have enough people is we've never paid people to treat mental health and addiction in the same way they treat diabetes, in the same way they treat cancer, in the same way they treat heart disease. So why do we wonder why there is no available therapists when we need help? Because the medical system, which by the way is a reflection of our society, so your politicians here in Greece need to make mental health a priority, which also means that we, all of us who care about mental health, need to make sure the politicians know that we care about it. One of the big problems in the United States is we don't have organized advocacy in the same way we have organized advocacy around cancer, around heart disease. We all know to get behind breast cancer. We all know to fight for prostate cancer. We all know HIV/AIDS needs to get treated. But how many people are willing to put up their hand and say, I am a voter and I care about how we treat people with addiction, how we treat people with mental illness? Frankly, there aren't many. And the reason it's taken us so long to get the governments, whether they're in Greece, France, England, the United States, wherever they are, to put any effort behind mental health and addiction, is that they don't see the people willing to vote on these issues. They don't hear from you. And that is the problem. It's nice that we're all here, but going forward from here, we need to build a political movement that will begin to change the direction and integrate mental health and addiction finally into the House of Medicine. Thank you so much.
Thank you so much for your insightful talk. And now I would like to kick off our Q&A session with a question from our SNF app. What is the biggest barrier to mental health parity at this time, and what is required to correct this?
So, as I said, it's not just medicine, it's housing. If you want to treat someone with addiction, they need to have a stable place to live. If they're living on the streets, you can't expect them to recover simply because you give them some medication and some medical care. So we need to make sure that your government authorities that are in charge of housing know what they need to do to help us address this crisis. We need to go ahead in the crisis, and that is try prevention. Prevention, prevention. We need to make sure your departments of education train our young people to know that their brain is part of the body, and they need to make sure they understand how to better manage the stress that our young people are suffering today, so that we don't wait till someone succumbs to mental health and addiction challenges. We try to help them prepare themselves. And so that's Department of Education. And there are many other departments. The problem is we don't understand that to treat mental illness and addiction, you need to also treat the social conditions that surround treating someone from the biological illness of addiction. So we have to do a number of things at the same time.
Yes. Thank you. Thank you so much. As we're running out of our time, thank you again, Mr. Patrick Kennedy.
I want to acknowledge I have my wife and my 5 children here. And and I want to say I grew up a child in an alcoholic home. None of my children have ever had to see either one of their parents under the influence of drugs and alcohol. If we want to make a difference in the future of mental health and addiction, parents, all of us, need to do a better job at how we model our behavior towards our kids. Fortunately for me, I got into recovery just before many of them were born. So for me, I am hopefully trying to break the cycle of addiction in my family, which runs deep. Thank you so much.
Thank you.